Hello everybody, it's me, Abby, and I'm back to work with you guys on the beautiful model, Lauren. Today we're going to focus on her abdomen and the fascial connection and the cranial rhythm involved and how to get this area to release. I'll see you there. So first I'm going to tune into her abdomen. Sometimes this area can be a little vulnerable, a little raw, not usually touched, not usually seen. And so as she breathes, I can feel her stomach rising, and I can feel areas that are mobile and areas that are not. I'm sort of focusing on the light weight of my hands on her belly. And as I listen and feel, I'll start to move with her breath. Already I can see that this right side is not lifting as much as the left side. There's a shortness in the psoas. And I'm not going to do much, I'm just going to pay attention. The fascial tissue begins just underneath the skin. So it does not take much pressure to identify, pull, or affect this web structure. So now I'm going to increase my pressure and do some rhythmic effleurage strokes back and forth to wake up this area. And don't forget the rib cage. And here I can cup my fingers around her hip, inside of her waist, and just lightly pull back with my core, at the center of my gravity. And now I'm going to repeat it on the left side. All the way up. So now we're going to come in to this diaphragmatic area and begin to create a little space from the bottom of the rib cage and that diaphragm. The diaphragm looks somewhat like a balloon, a semicircle balloon that lives within the cave of your rib cage. And I can already feel a little bit more tension on the left side. This area is clogged and can be more dense on quite a few people. This area also holds the spleen, which is a major organ in our lymph system that filters and purifies toxicity in the body. I'm making sure to keep my fingers somewhat flat so that I'm not poking into any vulnerable soft tissue in the abdomen. And it's giving me a better sense of the subtle, fine muscles of the psoas, obliques, and abdominals. Whenever you do direct pressure, make sure you're slow, taking consideration to their sensitivity and how they're responding as you deepen. Take a minute to lengthen this left psoas. And also give it a chance to guide me wherever it needs to go. This can be very soothing and stress relieving. Personally, it feels like an itch I did not know that needed to be scratched. I'm just driving constant pressure down the obliques, transverse abdominal, and psoas. Now, typically, there's a lot of tension on one hip. Most likely they are working in a cross diagonal relationship to the opposite rib cage. So at this point, I'm going to place both hands on both areas, trying to understand what their connection is. As I slowly deepen my pressure, I can start to tune into their fascial connection. Feeling like this right oblique lat area is somehow restricted or compensating for the tension in the left hip. Going to effleurage and tune in and see. Now I'm going to do some smooth effleurage to help integrate the information and give her a little bit of rest on that deep work. The right psoas is really the issue. Sometimes these areas can be very tender. I'm going to warn everybody once again. Caution. Usually just above the pelvic crest right here. You can find a lot of dense muscular tissue, which Lauren does have as well. Using the top of her hip and TFL to help lengthen this fascia in her right hip. I guess the one thing I love about abdominal massage is you can really feel around the body and how everything is affected and systemically connected. I'm going to work the opposite connection, the cross-diagonal connection between the left hip. And now I'm going to work the cross-diagonal relationship between the right hip and the left ribcage. Once again, tuning into the breath, the nervous system, and the tension to see how these two are related and if they are restricting each other or not working compatibly. This is very helpful if you feel like you have a twist in your body. Hard to explain. If you are a golfer, you'll understand. Tennis players, anyone who does some serious twisting in their sports or profession will know what I mean. Finish it off with a little more effleurage to integrate the information. And that concludes our massage. Before we end our massage, I would love to shout out to our Patreon members, Amir, Michael A., and Chad. If you enjoyed this video, please check out our Patreon page.